Dr. Ibejuku Sanwo-Olu, in collaboration with the Orusil Wellcare Foundation, has donated an undisclosed sum of the pediatric unit of 3 general hospitals to support free surgical operations for children. Good day, listeners. Welcome back to DDM Health News Updates. On our program, Your Health, Your Wealth. I often remind you guys to subscribe to our YouTube channel, that is Diaspora Digital Media, to get the latest on health. So what do we have today? The National Agency for Food and Drug Administration and Control, popularly known as NAFDAC, has seized counterfeit and unregistered products valued at over 47 million naira in a raid carried out at the Ibrahim Babangida International Market in Suleja, Niger State. The operation, which targeted the circulation of banned and substandard goods, also led to the sealing of a warehouse owned by one Alhaji Ahmed. The facility was found to be stocked with large quantities of monosodium glutamate in 25 kg bags, a product long prohibited from large-scale importation in Nigeria. You can imagine. NAFDAC revealed the details of the operation in a statement released on Tuesday on its X page. The agency said, NAFDAC has sealed a warehouse in Niger State operated by one Alhaji Ahmed for stocking large quantities of monosodium glutamate, that is the MSG, in 25 kg bags, a product banned for importation into Nigeria. NAFDAC officials uncovered a wide range of counterfeit oral care products bearing fake or misleading labels. Nigeria. This included poorly imitated versions of popular toothpaste brands, as well as other unregistered and potentially harmful products. You can imagine, each day one fake product or the other. Among the confiscated items were counterfeit Oral-B toothpaste, banned foreign spaghetti, and unregistered products such as bamboo charcoal toothpaste, Corrugate and Glucogide triple action toothpaste, and adulterated Colgate toothpaste. Oh my goodness. Who knows which one is the real one this time around? Toothpaste, fake one. The agency said several shops in the market are now under investigation, pending verification of their inventory and compliance status. Monosodium glutamate, commonly referred to as Ajinomoto or white Maggi, remains banned for large-scale importation due to health and regulatory concerns. NAFDAC warned consumers to avoid repacked MSG and any food additive that lacks proper identification and regulatory approval. So please, always check the label necessary for a product, because NAFDAC advises consumers to avoid repackaged MSG and other food additives that do not carry proper labeling. Yes, products must have a valid NAFDAC number, a manufacturing number, and also expiring dates, a batch number, and the manufacturer's address to ensure they meet safety and quality standard. So please, if you're getting things in the market, always and often look out for all these. Like I mentioned, NAFDAC number, manufacturing and expiring dates, batch number, manufacturer's address to ensure they meet safety and quality standard. Also speaking, the agency reaffirmed its commitment to ensuring that only safe and properly regulated products are available in Nigerian markets, while also warning that enforcement actions will continue across the country. Please keep up the good work, NAFDAC. Next, United States President Donald Trump's administration slashed cancer research funding by 31% in the first 3 months of 2025 compared to the same period last year, according to a Senate report released Tuesday that accuses the White House of waging a war on science. The analysis, commissioned by the left-wing Senator Bernie Sanders, found that as of April, at least $13.5 billion in health funding had been terminated, including 1,660 grants, while thousands of scientific staffs were fired. You can imagine. Among the hardest hit was the National Cancer Institute, which lost more than 300 million from January to March compared to 2024, driving inflation adjusted grants funding to its lowest level in over a decade. Its parent agency, the National Institute of Health, lost about $2.7 billion. Oh my goodness. Since January, Trump has launched an unprecedented, illegal, and outrageous attack on science and scientists, said Sanders. The ranking members of the Senate Health, Education, Labor, and Pension Committee, that is the HELP Committee. Trump is not only denying scientific truth but actively seeking to undermine it, he stated. Based on interviews with dozens of federal scientists and health workers, the report paints a picture of chaos across the Department of Health and Human Services, led by vaccine specific, that is Robert F. Kennedy Jr. At the Centers for Disease Control and Prevention, at least 175 public health data sets were deleted, leaving doctors without vetted guidance on how to treat patients. Oh. This was a statement made by a physician. A 43-year-old colorectal cancer patient, already treated with surgery, radiation, and 48 rounds of chemotherapy, said her participation in a T-cell therapy trial at the NIH was delayed due to staff shortages. Oh my goodness. The reality is that by reducing money and staff, the NIH will not be able to produce my treatment, and it might cost me my life, the senior stated. She told the staffs. At the NIH Clinical Center, researchers described complete chaos after entire labs were dismissed. The administration has a lot of blood on its hand, said one. We just want to take care of people. The report also highlighted the dangers of misinformation amid a growing measles outbreak, which has infected more than 1,000 people and killed 3. Over 40 grants studying vaccine hesitancy have been cancelled. Meanwhile, Kennedy has hired vaccine conspiracy terrorist David Gere, previously disciplined for practicing medicine without a license and testing unproven drugs on autistic children, to investigate an alleged connection between vaccines and autism, debunked by dozens of prior studies. Even as Trump proposes a 26% cut to the HHX budget next year, he has earmarked $500 million for Kennedy's Make America Healthy Again initiative, which targets nutrition, physical activities, and over-reliance on medication. AFP has sought the administration's response to the report. Now, up next, the wife of the Lagos State Governor, Dr. Ibejukwu Sanwo-Olu, in collaboration with the Orusil Wellcare Foundation, has donated an undisclosed sum of the pediatric unit of 3 general hospitals to support free surgical operations for children. Aww. The donation was made during visits to the General Hospital, Odan Marina, Femi Gbajabiamila Hospital, Sulurele, and the Igandun General Hospital on Tuesday. Sanwo-Olu explained that the initiative aligned with the Lagos State government team's Plus agenda and is aimed at alleviating the burden of medical expenses for families in need. She emphasized that many families are unable to access critical health care due to financial constraints. In line with the Thames Plus agenda of the state government, which focuses on social inclusion, particularly for people with special needs and disabilities. I commend the strong partnership between my office and the Orusil Wellcare Foundation, built on a shared commitment to the health and future of every Lagosian, she stated. Today, the foundation is once again demonstrating this commitment by supporting the 2025 Pediatric Surgical Care Initiative, bringing relief to children in hospitals across Marina, Alimoshu, and Surulere. This visit reflects our collective vision to ease the burden on families and offer hope where it is most needed. What a heartwarming assistance. Acts of compassion like these remind us that healing is not only achieved through medicine, but also through presence, empathy, and partnership. Yes. The First Lady called on corporate organizations and individuals to emulate the gesture by supporting healthcare initiatives in public hospitals. So, Project Director of the Orusi Wellcare Foundation, Mr. Laja Odunuga, said the donation was inspired by the vulnerability of children who often depend entirely on others for survival, especially during medical crises. This donation is a seed we hope others will build upon to provide affordable health care for indigent children. So we have established a robust selection process in collaboration with hospital social workers to ensure that only truly deserving patients benefit, Odunuga noted. The Medical Director of General Hospital Marina, Dr. Abiola Mafe, represented by Deputy Medical Director of Dr. Akindele Akilade, expressed gratitude to the Office of the First Lady and the Foundation for the impactful initiative. So please, keep up the good work. And with this, other NGOs to also follow in collaboration with the First Lady, that is Mrs. Sawolu, to help those who are in need.
The Orusi Wellcare Foundation has set a commendable precedent for other NGOs and corporate organizations. I therefore encourage again stakeholders, corporate bodies, faith-based organizations, civil society groups to join hands with impactful initiatives like this. Together we can build a Lagos where no child is left behind due to financial or medical frontiers.
One of the things we noticed was that some people have it difficult to pay for their hospital bills, and we looked at what people will look at vulnerable children in the community, and we found out that quite a number of them who come to the hospital cannot afford to pay for surgeries. So in order to support those people, we came together and tried to raise funds and identified certain hospitals where they provide those services. And then we looked at providing some support in terms of financial support to help them pay for their hospital bills.
Next is the Rounded General Hospital Surulere, where patients also benefited from the initiative.
I just touched my neck and I see something there. And I said that is boy and I leave it. The next day I not to my mommy. So mommy now notice. All my friends have run from me.
I'm very, very grateful. Thank you. I'm very, very grateful. Thank you. All that helped me, that God, they will not see the situation like this for their life.
Lastly, the team visited Igondo General Hospital, where the beneficiaries applauded the initiative and promised to ensure those in need get access to the services.
This news of donation to pediatric surgical patients is a welcome idea. This is something we've looked forward to. It occupies a big niche amongst the services that we render. Oftentimes we have a lot of clients who cannot afford to pay for surgery, pay for admission, particularly in that vulnerable group, the pediatric group.
I look forward to interacting more with them and for more collaboration and more assistance for them. So I thank them wholeheartedly for even thinking of us and coming this morning to show us their support and their love.
Well, we say kudos to the wife of the governor of Lagos State. So with these, friends, we come to the end of today's news on your health, your wealth. please don't forget to like, share, comment, and subscribe to our YouTube channel, that is Dasral Digital Media, to get the latest on your health. Until next time, I remain Nene Michael Inezime. Thanks for watching and do have a wonderful day. Bye for now.